process. We'll also be sharing some updates around community partner and SNAP assistance. We'll also be sharing some updates around OHP Bridge and an upcoming advisory committee, some enrollment timelines, and then we'll also have a chance to review some of the questions that we've received and to respond to some of the questions. And then we'll also have some time at the end for discussion. So I will go ahead and pass it on um, to some of my teammates. So Sean McAnulty, go ahead and take it away.
Hello, my name is Sean McAnulty. I'm OHP's Member Communications Coordinator, and I'll be taking through our three topics today. So we'll be starting off with renewal updates, talking about the pandemic unwinding and where we stand there. So it's been a while since we looked at the full chart version of this. We had that initial 10-month plan in the purple where we sent out the initial 10 waves of renewals. Then we had the response period from those 10 waves. At this point in the blue section, we are nearing the very end of our outgoing waves. Those would have just hit the mail this week, or will be hitting the mail this week. After that, we are going to head into the long tail of unwinding, which is in the very light blue on the far right side of the screen here, where we'll have about 5 months where people are responding to their renewals, but we're not sending out any additional ones that are affected by the pandemic unwinding. So as that goes forward, we're going to have a shift to more normal response timelines, and those will start adjusting over October through December. We'll see some renewals going out back on the normal response schedule that have a shorter um, response expected of them. We have some tools coming up about that as well. They're not in this presentation today. So at this point in the process, we have 0 renewals left that have not been started as of this week. And then 5.5% of renewals are in that active state where they're currently expecting a response from the member, or the state is processing their response if they've already responded. Otherwise, 94.5% of renewals are now complete. We are really getting down to that last 5% of them. So in that remaining group, there's about roughly 3 groups of people there. The first is people who have this Oregon Supplemental Income Program medical. If you've been to these presentations lately, you've heard this quite a lot. OSIPM provides OHP coverage for people who are legally blind, have a disability, and are 65 or older specifically. So that group really sways the demographics of renewals we're seeing happening over the summer. Then there's another group that were affected by what we called the ex parte renewal change, which was us looking at the passive renewal process and making sure it looks at the individuals in the household on their own rather than as a family. That way it doesn't ask for a response from members of the family that don't need to actually respond to keep their benefits. And then those are necessarily households. So all the other household members on cases with a member in either of those groups are also going to be up over the summer. So that's who's going right now. And because some of people's benefits have previously closed or reduced and then were restored, we're starting to see some higher termination rates than we would expect, or especially benefit downgrades. And just knowing that OSIPM group, due to the age and disability needs there, is going to be a higher needs group, we intentionally slowed this down, so there's only about 30,000 renewals happening every month in the summer waves, compared to as many as 160,000 earlier in the process. So we're really slowing down the cadence here in order to allow for more support from partners like yourself, so you don't get swamped with these people, and for the caseworkers and other things that people who have these benefits might have as well. We are at that 94.5% complete out of the process, with 82.5% of people continuing on benefits and 16% ending. Where we've really seen a difference from last month is in the benefit reduction category, which is people who are most commonly, this is people going from full OHP to a Medicare savings program only. Those Medicare savings programs pay their Medicare costs, like their Part B premium, and it might pay their copays and deductibles as well. So they're still getting some help from the state. That's really important, but we've seen a 4,600 person increase in that category since last month. Given the numbers are so low, that's a pretty sizable increase there. That is basically a mirror of what we saw when we restored benefits earlier in the pandemic unwinding process in the fall. When that happened, we saw the benefit reduction category drop significantly. We are seeing that rise now again as some of the people who are in the earlier waves over the summer have responded are now having those reductions happen. So if someone's income and resources haven't changed since their previous reduction, we would expect the same outcome, but we really want to give them the opportunity to respond if anything has changed, and we've clarified the notices and whatnot in that May system update to make sure that people have the opportunity to keep benefits if at all possible there. But we are starting to see the data show for people who are not. So some of the additional things we're doing for this group, given the particular needs here, are having our a contractor PH Tech that is part of our call center call members who have 30 to 60 days left to respond. The one system sends out a 30 to 60 day reminder notice as well at that time. We're actually pairing that with a live outreach call as well. They're going down through 3 groups of people, which have some overlap. There's the OSIPM members who have long-term services and supports, call first, followed by the Medicare Savings Program members, and then the OSIPM members who have neither LTSS or a Medicare Savings Program. So they're getting those additional calls, both answering questions about their renewal process and generally providing information, as well as really trying to schedule the renewal with an eligibility worker if the member needs that. So when that's being requested, it's currently the single most common request type. We're really trying to use that call effort to get those scheduled. Looks like we got a hand up. Iris?
Apologies, that was an accident. Thank you, though.
Alrighty, I'll move on. Otherwise, in addition to the calls from the call center, we also have case managers for members who have them. They're assigned caseloads, essentially. So if somebody comes up for a renewal, their case manager is going to get a flag if they have one, and that case manager is also going to reach out to them using that personal connection. They're required to have monthly check-ins with all of their long-term services clients. Though not everyone has a case manager in this group, it's only the people that have long-term services and supports, and even then only some of. So, but for the people who do have a case manager, it was worth doubling up. So they're going to be getting that outreach from their case manager in addition to the call center, which is only to the people who haven't responded by the 30 years to share member data on a monthly cadence with our agency partners like the CCOs and Open Card care coordinators. I also wanted to note that similar data is available for community partners. Like for an application assistance organization, if your clients haven't responded, we can provide a list of the people who terminated for non-response who are associated with your organization. That is available through regional outreach coordinators. If you ask that, they'll get in touch with the central us who are cutting up the list, and they'll be able to distribute that list to you, which can be productive for outreach as well. Otherwise, we're seeing some patterns in the summer renewals where they're much more likely to be disabled or over 65. They're far more likely to be going into an active renewal mode where a response is required, as opposed to being passively approved without a response. Previously in the pandemic, we saw about 2/3 of renewals were passively approved and weren't needing to respond at all to keep benefits. That is flipped over the summer, where most renewals, about 2/3, are getting an active renewal that needs that response. So that's also partially going to explain the higher termination rate there. We've also got an interview with eligibility worker coming up as the most common request type. If you haven't done one of those with a client before, that's worth trying. Community partners can help clients complete the interview by calling the community partner access line, though the member and or their authorized representative needs to be with you on the line when doing so. But the scheduling portion of that can often be a hang up for people, so having someone to walk through that process can be really helpful for. Also wanted to repeat some messaging for people losing long-term services or OSIPM, where if they are losing those benefits due to having higher income or resources of renewal, they may have options for redistributing their finances in order to remain eligible. Members who are over those resource limits should always speak to an eligibility worker before making any financial decisions, but we want them to investigate that possibility with and ask those questions to the eligibility worker if they are at all interested in that. We do not want people or mistakenly taking harmful financial steps like selling a house in order to qualify. We really want them talking to an eligibility worker if they have any questions about why they were over a resource and if they have options for that. Another thing we're going to see a lot of with that spike in the benefit reductions is people needing Medicare choice counseling. So if you have Medicare and are losing full OHP benefits, that may change what decisions you want to make regarding your other Medicare plan choices, like Medicare Advantage plans or Medigap supplements, Part D plans, all that stuff. We really want those people to get choice counseling help from senior health insurance benefits assistance counselors or SHIBA counselors. They're the equivalent to assisters on that Medicare choice counseling role. They can be reached at either that phone number on screen or the same Get Help locator tool on the OregonHealthcare.gov website. But that choice counseling is going to be a particular need in the next few months, given those benefit reductions we're seeing be more common in the data right now. Okay. I just want to take a moment before we move on. Any other questions on the unwinding topic? You can raise a hand or put it in the chat. Otherwise, we'll keep steaming ahead. And we're going to talk about helping with food stamps. So the Community Partner Food Focus team is excited to announce that medical assisters are now able to call the Community Partner Access Line to assist with the Supplemental Nutrition Assistance Program, or otherwise known as SNAP benefits. I do want to start off that this is not a broad expansion of the community partners' powers to be equal to what we have on the medical side of things. This is a starting point where we're really endorsing using all the ways you can use the current system to get people this help. It's not the large expansion where y'all get access to it through your applicant portal accounts and things like that. But using the current system, community partners can help with applying for SNAP and SNAP renewals, contacting the community partner focus team. That way the eligibility workers can conduct the SNAP interview as part of the application process. And you can also report changes and provide verification documents. So we're going to talk a little bit more about each of these. There are going to be more guides coming out on this whole topic in the future. CPOP's working on some of their own, but we've got a bunch of resources on the websites already that we wanted to highlight here. So one of the main things you're going to need to know about is there's a separate consent form for the SNAP benefits side. As always, you need to collect the 66 medical consent form that you're used to in order to assist your client at all. That doesn't change. This doesn't supersede that. Nor does the medical consent let you access their SNAP case in the sense of workers being able to share information with you. So there's a similar 3010 consent form that you can find in the form server. We've got a link here that's in the slides that'll be all these will be distributed at the end. This 3010 consent form you can see on the right side is the equivalent for the SNAP side. That is not needed to assist with the SNAP application itself, or if you're just calling in to connect the worker with the interview, if the member with the interview. If the member is just talking with the eligibility worker, you don't need the form just for them to have that conversation, but you do need this consent form in order for workers to be able to share any info with you, or for them to be able to communicate with you at all about when the applicant is not present. Just wanted to note some instructions on these forms. There are additional instructions in the document, but the top section, the top quarter of the page on the right, is the applicant's information. Then it's followed by a release from section where you would fill out ODHS's information. There is contact information from the medical consent form that gets filled out in the same contact for email, fax, and mail info as at the bottom of the medical consent form. And then you would release to your assister organization's contact information, and then get a signature on the second page where we do require a physical or a DocuSign signature here. And I would recommend you pre-fill this out with the release from and to sections, because that'll always be ODHS and your assister organization. And then the client only needs to fill out their name and contact information at the top and then sign and print their name at the bottom. So that's the consent form you use for that equivalent work. So there are some limitations here on the system side that are going to present some barriers, but this is the rules we got to work with, and there's some really tremendous things you can do for clients under the current system that we want to enable and endorse. So you're not going to have access to the food stamp application in your Community Partner 1 account in the same way that you do for medical, nor can assisters sign for applicants in the way they can for medical. Basically, what this means is that the person that you're helping is going to have to enter all the responses themselves and lead the application. So unlike with medical, you have to fully turn over the computer to them and let them drive the application. You can't answer the application or interview questions on behalf of the client in the same way as you can for medical. That does present some barriers for language and disability. For language, you're often going to have to find a paper application of the language that your client speaks so that they're able to directly read those questions and whatnot, rather than the assister providing interpretation for them. There are also not exceptions for remote signing, so this is often going to limit the signing of that 3010 form to in person, unless you have a remote DocuSign option available to you that works for that. That also does mean that because you can't answer for the client, that the applicant will need to be with you on the line for most phone assistance, though there are some ways you can relay in updates through a written document or something like that. So we want to provide some information about the rough application process as well. In general, the process starts with an application online through paper or over the phone with an eligibility worker. Partners are able to help with any of those. If the applicant doesn't have a time for the full application, though, contacting ODHS to letting them know of the request for benefits establishes a filing date, which is important as the start date of benefits once they're found eligible and complete the application process if they do that within 60 days. Then after the application, an interview with eligibility worker is going to be required. I do want to caveat, though, that the application information can also be collected during the interview, so a separate application beforehand may not be required. Just calling the Community Partner Access line is a complete route to do an application. Then after that, there may be any requests for information you need to complete that's pretty familiar to the medical process, and they work in a similar way. And then after they've been approved, their EBT card can be picked up at local offices anytime after approval, or you can call the helpline with the phone number on the screen to get one in the mail, though often picking it up at the local office is an ideal way. That way they can use their benefits the same day, assuming they're approved and available and all that. So just some notes on using benefits. The benefits that show up on their EBT, electronic benefits transfer card, also known as the Oregon Trail card, you might have heard of it that way. That can be used as like a debit card at any grocery store. On the right side, we've got some examples of what it can and can't be used on. Those benefits show up on their card at the beginning of every month in the first few days. So it can be helpful for partners to have some basics of the eligibility limits. We want to caveat that we don't want you screening out people or anything like that. And there's a lot of differences between how the income and household rules work between the medical and the food side of things. But this is a basic primer that hopefully will get you the idea of who you might want to encourage to apply, though always it's the client's decision or the member's decision. There are different household rules than for medical. The general standard for SNAP is that they follow everyone who are living and preparing meals together are grouped together for SNAP. That's different than the medical household, which has its own rules. There's also different income standards that vary somewhat and have a lot of exceptions here, but these are the general operating ones that we wanted you to be aware of. For most households, their gross income must be below 200% of the poverty level. That's the same as OHP Bridge's income limit. We've got examples on the right side of the screen here. It may also consider their net income after costs such as child support or medical expenses if they're over 60 or disabled. That can be considered, so that may weigh in as well. And in some cases, there are also going to be resource limits that apply. All of these have some exceptions. It's a complicated system. Your role is really to be the intake, and I'd really focus on that 200% of income limit. Those are the folks that it's definitely worth screening and asking if they want to apply in that situation and presenting that option. Basically, there are different routes you can take for an application. If that person wants to apply for SNAP as well, going through their own one account rather than using your applicant portal account, and it's worth doing that sort of check with them to see if they might want to get those benefits that way. Continuing on the eligibility basics, we also wanted to touch on citizenship and immigration, where, again, it's very different from the medical rules, especially since Healthier Oregon. For food benefits, many non-citizens will be eligible for SNAP. This includes anyone with a humanitarian status like refugee or asylee or other similar humanitarian statuses. It also includes lawful permanent residents who meet one of these three requirements, which is either having 5 years of long-term resident status. That might be familiar to you as the 5-year bar in our medical speak, or 10 years of Social Security work history, the same counting system as Medicare uses for those work credits. There are also ways to qualify based on disability if you're a long-term permanent resident or if you're under 18. Another update is that as of March of this year, people with the Compact of Free Association status, which is a status for people from Micronesia, the Marshall Islands, or Palau, where they're able to live and work in the United States freely, they're also now eligible to qualify for SNAP benefits when they weren't before. So that's an exciting bit of new access to benefits for a new group. Then applying for SNAP does not make the participant a public charge and will not be considered a public charge determination. So we just wanted to note that given the sensitivity of that concern with this population. Beyond that, the food benefits also have work requirements that might be unfamiliar to the medical assister community. The term that's used for this is ABAWD, A-B-A-W-D, able-bodied adults without dependents. So that refers to anyone 18 to 52 who does not have children under 18. If they are considered that status, that ABAWD status, they must meet work requirements in order to receive SNAP for longer than 3 months in a 3-year period. There's a huge list of exemptions to this, though. I've got a very partial summary here on screen, which is anyone who's disabled or unable to work due to a physical or mental health reason, anyone pregnant, experiencing homelessness, veterans, students. There's a whole long list of other reasons here, but that's something to talk that will come up in the application as well. So what community partners can do to start getting their toes into the water here. First off is to go take a look at that consent form from the form server. I've got a link in the slides here. I would encourage you to give these a download and click through these links here after the meeting. There's also an eligibility 101 that focuses on SNAP eligibility. There's an outreach toolkit, which has a lot more information on these topics, as well as the paper application, which is worth reviewing to get a sense of the different questions that are on the SNAP application that are different from the ones that you might be familiar with from only seeing the medical questions. There's also a full tutorial application you can watch that's about an hour long. There's also going to be an office hours tomorrow on the One System, where this will be heavily discussed as well, that you can attend. And then for putting this into practice, once you feel comfortable with the material, a few ways you can start integrating this into your work and whatnot is when a client comes to you, start asking if they want to apply for SNAP as well. And if they do, if you're working in person, help them create and log into their own One account and then apply online for food and benefits all at once through their side of things. They're going to need to lead the application, and you can counsel along and direct them what the questions mean and things like that. So you're playing a more supportive role in those because we can't answer the food questions directly. Or if you're needing to call in with an applicant on the line with you for any reason, for instance, doing one of the interviews for those non-Magi clients, if the client wants to request SNAP as well, they can apply and do the interview for SNAP at the same time as you're calling in with that worker. So if they're going through the medical application verbally, they can do the SNAP application at the same time if they have the client on the line with you. I've had cases where people have walked away with $700 in old benefits that they've been able to use to eat this weekend after they couldn't get an interview by the end of that Friday afternoon. So being able to call in and do that for clients can make a huge difference, and then send them into the local DHS office to pick up their card right afterwards. Other thing to try is reporting changes via secure email with that 3010 consent form. Without that 3010 form, they're not going to be able to respond to you if there's any follow-up information they need or questions about the, for instance, pay stubs you sent in. That allows them to respond to you with the SNAP-specific information or questions they have as well. So those are some easy ways to start getting your toes into the world of SNAP assistance. We're going to see food become a more prominent part of the community partner world, as especially the health-related social needs waiver food benefit will be happening in 2025. So we want to start providing some information on how the how you're able to work on the food side of things under the current system before we add in the medical side of things as well. So a lot of information to come here. Probably after open enrollment season, we'll talk about this more, but wanted to give you all the tools we have at the current juncture to be able to work on that. Questions can be directed to snapoutreach@dhsoha.state.org.us. Okay, it looks like I got some questions in the chat.
Yes, and I can read some of those out loud for
Thank
you.
you.
So I know I tried to respond to a couple of them. So some of them were about the slides, which I believe are going to be emailed out in a follow-up email,
Mhm.
and they'll also be posted on our website. But then one that I was trying to respond, but I think it might be better to answer out loud. So Michael had asked if someone is over income for OHP and received a notice to respond by September 30th, when will they receive a notice that they are terminated from OHP? So I think that one's kind of a complex because it depends on whether it was an unwinding renewal, but I'll let you handle that, or I can answer it too.
Yeah, all the renewals through currently are still under the unwinding time schedule. The non-unwinding renewals get the same time frame as the unwinding renewals until the October wave at least. So if they've already received that notice asking for the reply by the end of September, they would have October and November as their 2 months of advanced warning of the benefit closure. So I'd expect end of November would be their termination date based on what you described.
And also if oh, just in general for people who have to respond, like say if they haven't responded by a certain date, it hasn't been processed, just remember that there's that 90-day reconsideration period. So if somebody, even if they've already gotten that letter saying like, hey, your benefits are going to be closing because you didn't respond, they can still respond to the information that was requested of them without having to complete a brand new application. So as long as it's within 90 days, after those 90 days, they'll have to submit a brand new application. And then I think
Yeah.
there was a couple of other questions that I'm trying to track down the answers to. So somebody had asked about the medical consent form, the 6610, the community partner consent form. And I just asked somebody about the status of that, but I'll let you know as soon as I hear back from that one. And then there's a question about SNAP. SNAP does not currently have, oh, they were asking about the SNAP application, if it was available in Marshallese. Looks like it's not currently available in Marshallese. However, if there's a need for it, we're happy to look into, the response was that we're happy to look into translating this. But for the OHP application, it is available in Marshallese, Palauan, and a few other languages, many other languages actually in our form server. And I can post the link to the form server in the chat in a little bit.
Chuukese as well for the
Chuukese.
Kofa populations there.
Yeah. And I can't see, do you see any other questions? I'm trying to see if any that I haven't responded to yet.
We also recently translated the rights and responsibility and privacy practices into those languages as well. So you can do the full application and full informed signing as well now. Any other questions? Otherwise, James, we got a note here.
Yeah, I just wanted to do a clarification on the slide back on ABOD. That, you know, it's a complex subject and there's a team that handles those questions, but I just wanted to point out that currently under federal restrictions, these are only applying to Multnomah and Washington counties. So just a little tidbit to put on the record.
James, I'm having some trouble hearing you. It sounded like you said something about it applying to Multnomah and Washington County.
Correct. Yes. It's just Multnomah and Washington counties for ABOD restrictions.
Thank you. Any other questions, or should we move on?
Just saw a couple more questions come in. So it says the notice has to respond, if a notice has to respond by 11:30, but the One Portal benefit screen says to renew by 10:31. So the member needs to renew by 10:31. Oh, great question, NJ. I think this is related to that. I'll let you handle that one, Sean, because I think you.
Yeah. So right now it's a bit confusing. That renewal date in the system is what functionally during the unwinding, that's only for how the renewals get triggered. We do it in advance of that date by 3 months. That That is different than the reply by date that the member needs to take action by during the unwinding. The renewal date is 1 month before the member needs to respond during the unwinding. The reply by date would be the focus during the unwinding. After we go back to normal timelines, the renewal date is actually their termination date if they don't respond. So right now you get 90 days of an extended response period plus an additional 60 days of advance notice of termination. That final termination date is the closest analog to what the renewal date is in the system. That's going to get a lot simpler as we return to normal timelines, which happens starting with next month's wave of renewals.
And that was actually the next question from Susan in the chat was, will the 60-day extended termination period for medical renewals or for medical continue, or will it end with the end of the redetermination activity? If it will end, when will the change take effect? Sorry, I'm wearing contacts and I cannot read as well, little writing with my contacts, but Sean, I'll hand that off to you.
The timelines are not going to continue with the end of the at the end of the pandemic. Basically, this last wave of pandemic unwinding renewals, we'll see a change in the timelines. We do have a slide in the next collaborative that will be describing the timelines for all the upcoming waves. I kind of wish I had put it into this presentation. I will try to get that into the chat here as soon as I can drop my screen sharing once we're done with the presentation. We can at least include that chart in the follow-up email as well.
And I think that's all of the questions that I see. So if you want to go ahead and move on to the next section. Thank you.
So if you aren't familiar with OHP Bridge, that's the new benefit we launched in July for adults with higher incomes. It's up to 200% of the poverty level, aged 19 to 64. You can't have other affordable health insurance using the same definitions as the marketplace uses. And you need to have eligible citizenship or immigration status to qualify for that. Benefits are almost identical to OHP Plus. Only difference is that it doesn't come with the option for long-term care, nor does it have this health-related social needs benefits that the climate waiver and the climate and housing benefits that are coming through the waiver. Those benefits aren't available to OHP Bridge members. Otherwise, OHP Bridge is free coverage, same as OHP. It's really going to feel the same to most members in that regard. There are 2 OHP Bridge programs, though. OHP Bridge is a benefit package with 2 programs within it. The first one is OHP Bridge Basic Health Program, which is exclusively managed by CCOs. There's not the option to have open card on that. Most members will have the Basic Health Program. Then there's also OHP Bridge Basic Medicaid, which allows American Indian and Alaska Native members or people who have parents or grandparents in a tribe. Gives them the option to choose between the CCO and open card coverage. So it's a different program. It has some different rules that inherit more Medicaid rules rather than the marketplace rules that Basic Health Program uses. But the main difference and reason for existing there is that way they have the option to continue getting services through open card, which is often preferable for Indian Health Service clinics and whatnot. So as of the beginning of the month, we had 23,000 people on OHP Bridge. 22,500 of those were on the OHP Bridge BHP, and 803 were on Basic Medicaid. We've got 3 groups that are going to be enrolling over roughly the next 3 years. There was the big group of people, about most of that total that we saw there, who moved from being on Oregon Health Plan previously, the bottom category on this slide. They had been kept on OHP since their renewals during the unwinding and moved over to OHP Bridge in mass on July 1st. Though since we put in continuous eligibility and most people are keeping their OHP for 2 years after they report an income change, or for the rest of the 2-year span after reporting an income change that would put them into the OHP Bridge category, we do expect to see more people moving from OHP to OHP Bridge over time. Then over several years, we're also going to see people moving from the marketplace as they update their marketplace applications. If they appear to be eligible for OHP Bridge, it's going to send them over to us to be screened for OHP Bridge enrollment. We expect to see a spike in that during open enrollment, and we're going to feature that heavily next month with our open enrollment messaging. We've also got a group of people who are currently uninsured who we want to sign up for OHP Bridge. This is a group that may have lost OHP after the pandemic or wasn't eligible before, and we want to connect with now. This is one of the main targets of the outreach we're doing right now, is this uninsured group. Other updates about OHP Bridge is that they're launching an OHP Bridge advisory committee. If you want to participate in helping administer the program, recommending benefits for what to do with the trust fund, member outreach communication, and all the updates for the program and how we meet federal requirements. They're looking for 13 members, including OHP assisters, healthcare program representatives. You all should be in a category that would qualify for this. If you're interested in getting involved, the recruitment is open until later this week. English and Spanish application links are up here. You can find additional information on the OBAC website, but as this committee goes forward and the OHP Bridge Trust Fund builds up, they are going to be looking at things like whether to add health-related social needs benefits and long-term services to the benefit package in the future. There are many things that that group's going to be considering that will be very relevant to members, and this is your chance to participate in that if you'd like. Otherwise, one of the main resources for partners is the partner training. If you haven't taken this yet, we recommend you go and do so. It's available at this link on screen. This is intended for partners to be doing before you're doing any OHP Bridge applications. We'd really recommend you go take this training and learn all the details about OHP Bridge. We've also got some new and upcoming member materials. There are some new member-facing flyers in English and Spanish that'll be available shortly in additional languages. There'll also be a second wave of materials like a rack card and social media posts coming available there. They are using this health coverage, get it, use it, keep it branding. You'll also see more people now qualify for a free health coverage version of this as well, where we're really promoting using health coverage in addition to just getting it, and trying to be very inclusive of the marketplace as well, as a lot of the remaining uninsured population is going to be marketplace eligible or eligible for regular OHP. So these are taking a very non-specific turn. We're trying to get people with higher incomes to apply and share information about both OHP Bridge and the marketplace financial assistance on those flyers and whatnot. So take a look at those, and then I'm looking forward to rolling out more there. As opposed to those very general outreach materials I just shared, the OHP Bridge FAQ and Outreach Toolkit are very OHP Bridge specific. We're looking at additional materials that are going to be rolling out over the fall. Looking forward to sharing more plans about those, but you can find the toolkit and whatnot at ohp.oregon.gov/bridge. This has a bunch of graphics that we'll be sharing in the next few slides as well that are helpful for a bunch of points that partners have found confusing. And if you haven't taken a look and downloaded new income guide since July, I'd go grab that. That's been updated with the OHP Bridge income limits as well. So one of the main things that has been confusing for partners lately, and staff and members, we've been hearing about this quite frequently, is the enrollment timelines for OHP Bridge, specifically that OHP Bridge Basic Health Program always has future effective dates. It doesn't start the beginning of the month that you applied in like other OHP benefits do. This follows the same rules as the marketplace. So if you're determined eligible on or before the 15th of the month, your coverage would start the 1st of the next month. So if I applied today, my coverage would start at the beginning of October. If I instead applied after the 16th of the month, my coverage wouldn't start until the 1st of the month following the next month. So instead of the October start date, it would be November. So basically, if you got an August 15th decision, you get September 1st coverage. If it was an August 16th decision, you get October 1st coverage instead. So we've got some graphics on this, one for each program. So for OHP Bridge BHP, if you're applying anytime in the orange part of October, your benefits would start November 1st. Anytime in the purple part of October on this graphic, benefits would start December 1st. This has been a persistently confusing thing for people, so we really want to reiterate that this is always going to be a future effective start date for OHP Bridge BHP. That is distinct from the basic Medicaid enrollment timelines. where they follow the same coverage start dates and CCO enrollment timelines as other OHP programs. So for them, if they applied at any time in October, they would get benefits on the 1st of October if they're eligible for October. Same rules that you are used to with OHP. OHP Bridge Basic Medicaid also offers the possibility of retroactive coverage for up to 3 months, the same as OHP. So it's following all the same start date rules as OHP does. The basic health program, though, for most members will not offer same month coverage. It's always going to be future effective. So those graphics in particular, I'd take a look at if that's having trouble sticking. We'd also love any questions that would help clarify this. Okay, I want to take a moment for questions, then we are going to dive into question response, and then we'll have open question time at the end as well.
I do see a few questions that just came in. Let me see if I can read them. So is bridge eligibility decision based on the date of the application, or is there a timeline for an eligibility decision?
It's based on the date of the eligibility decision. So it's when the state processes it, essentially, once that step is complete. It doesn't base it off the application date. So there's a difference there. If your client is needing a decision by a specific date, expediting that through calling in or other processes to speed that up can be helpful for the client on that.
Thank you. And then there's another question that came in that says, I work for a developmental disabilities program, and we have had a grouping of individuals that were on long-term services, and with their renewals have been switched to the bridge program. And as a result have lost their services. Is there a quick and easy way to get them through a presumptive process in order to get their services back in place?
If someone's needing to get back onto or to get screened for long-term services again, I think contacting your local aging and disability or area agency and aging, depending on your region office, that would really be the best option to get that rescreening done, talking with one of the eligibility workers there. Yeah, OHP Bridge will not offer long-term services and supports. I think we might have had a question from you that we'll be presenting later in the next slides. Or we had a very similar one on this topic.
And I don't see any other questions. I did see somebody was asking about the one office hours that you mentioned, but James responded with the link in the chat.
Alrighty, I'm going to move on to the other questions. We're going to handle those, and then we'll have more time for questions in just a few minutes.
Okay.
So these are the questions we got via the email in the last month. So if you have, hopefully this might spark some additional questions from the audience too. One of which was, does OHP Bridge cover K-Plan services for intellectual developmental disabilities? No, K-Plan services are considered long-term services and supports, which are currently not covered through OHP Bridge. This is really getting to that question we just got, where if someone lost their long-term services and supports or K-Plan offering, and they're looking to get that back, rescreening through the local aging and disability office is probably the best bet. You could submit another application through other routes, but talking with that eligibility worker is going to give you the much more in-depth understanding of why you weren't eligible, and that would be my recommendation there. Otherwise, we've also been hearing a lot about wraparound payments from qualified health centers, which is an additional payment that these health centers are eligible for when serving OHP Bridge members or when serving OHP members as patients. And the answer there is that no, OHP Bridge does not have the additional WRAP payment at launch. As the OHP Bridge Trust Fund builds up over time, we may be able to add these for OHP Bridge in the future. The OHP Bridge Program Advisory Committee is going to be considering program design issues and uses of the trust fund like this in the future. This is another good reason to keep track of that committee's work that we just promoted in the earlier slides. We also got some questions about how OHP Bridge looks in MMIS. How does OHP Bridge Basic Health Program and Basic Medicaid respectively appear? So for both, the benefit plan is going to be Bridge BRG. For the way to distinguish them is going to be the PERC codes. That is going to be BR for OHP Bridge, BHP, And then for the basic Medicaid members, it's going to be PE, which stands for Permanent Expansion, referring to the Permanent Medicaid Expansion, another name for the program. So in a screenshot example, since that probably is a little bit more helpful, at least I find it so, on this line, this is the provider view of MLS. If you look at the highlighted line, you can see you've got the benefit plan where it says BRG OHP Bridge. That will be consistent regardless of whether they're a BHP member or a basic Medicaid member. Then on the far right side of that column, you can see there's the PERC code where it says BR there. That means they're a BHP member. If it said PE instead, that would be basic Medicaid. So that's how it looks in MMIS. Hopefully that's a hopeful example for those of you that are needing that. We also got some questions about how providers can verify OHP benefits. Core answer there is it should be working through the same systems as it does normally. So long as the correct benefits are selected. We've also been hearing from some providers that the same benefit start date confusion has been coming up on this issue as well, where they're trying to verify benefits before they've actually started due to those future effective start dates for BHP. Bridge appears in the Medicaid Management Information System, MMIS. That was the system we just showed, as well as the respective systems CCOs use for their enrolled members. Since BHP requires CCO enrollment, a lot of members are going to be NCCOs, so those would be one of the main systems to look for as well. As long as you're selecting OHP Bridge benefit type and the correct CCO, any eligibility verification systems in your electronic medical records should also work normally. If that's not the case, we'd love to hear that in more specific examples. We've also heard that the timeline confusion is coming up a lot there, so I would double check the dates on the eligibility notice as well as a potential source of where that discrepancy is coming from if it's not verifying when it seems like it should. Otherwise, we also got some questions about what's considered affordable health insurance for OHP Bridge. We'd appreciate a list of examples like insurance from work, school, spouse, etc. So affordable health coverage includes Medicare and employer-sponsored insurance using the same 8.39% of income affordability standard that the marketplace uses. That updates every year. We just got the new one for 2025, but we haven't done a whole lot of publicity on that one yet, but we'll see that shortly. So basically it's the marketplace affordability standard that'll be consistent. It'll always follow that. That affordability standard includes family coverage through an employer. It does separately weigh the price of family coverage, which is usually more expensive than employee-only coverage though. And then student health coverage does not disqualify you from OHP Bridge. So that's a specific example there. Then basically, our instructions here are to apply and let the system decide if coverage is affordable. The system will run all these numbers for you, put the correct information into that screen, and it's going to do the calculations. We really don't want people screening themselves out from applying. So that way they could potentially get other coverage they could be eligible for. For instance, they might qualify for OHP, which would be fine with the employer coverage being available as well. We've also got more questions about future effective dates and notices. This one's asking if we can clarify the future effective dates in one system and notices to make it clearer to members when benefits start. That way they don't go and schedule appointments before coverage begins and things like that. We appreciate the feedback. There are some internal conversations happening on what we can do to improve the one system as just an extension of we're always working on that. There were some conversations in the last week, though, about how we can specifically make those future approvals clearer. We now have that page one summary function, and we're investigating if we can use that to put more information about the future start date there to highlight that for members. The partner toolkit also has those graphics we shared that you can share it with members as well in order to help explain those start dates if that's helpful. Okay. Otherwise, we have open Q&A time. I'm going to drop my screen share and go grab that slide we referenced with all the different renewal dates.
Thank you. And there was a couple of questions. I think some of them you already answered, but then there was a question about the eligibility chart that says doesn't seem to be completely accurate. 100% says 1255 and 200% says 2430. And so,
Is this the community partner income chart?
yeah, I want clarification. Do you, Michael, which chart in specific were you referring to? Because I think if it's the one for community partners, we just updated it and released it like a few weeks ago, right? So I just want to confirm. I want to see community partner, the one that has like the blue and the orange, Michael. Correct. Oh, okay. Let me take a look at that really quick. We'll flag that one. Because apparently my computer doesn't like to do a couple of things while it's on Zoom. But
So
I'll flag that one.
the community partner income chart I have has OHP Bridge expressed in annual terms. I think we might be
Oh,
looking at
that's
something
right.
different.
Oh, I'm wondering if that's the one from the marketplace, because you're right, the bridge one that we have. Is it this? I'm gonna post a link in the chat, Michael, and let me know if this is the one that you're talking about. Oh, don't worry, Michael literally just posted. Oh, that's the one from the marketplace. We can talk to our marketplace colleagues about that one. Because if you're a community partner, so CPOP recently updated the one that community partners use, and that one, I think we shared it during last month's collaborative, so I'll see if I can find that and I'll post a link in the chat right now. Let's see if I have it easily accessible.
So the marketplace uses the previous year's FPL for income, and I think that's the accurate FPL for the rest of the chart's 200% FPL, and we just need to update it for that specific line because OHP is going to use the current year's FPL instead of the past year's. So I think we've discovered the error there. We'll get that fixed. Thanks for the flag.
I can help answer the start date question that's in the chat.
Yes.
Oh,
Go
thank
for
you.
it, Tim.
And just for folks who don't know, I'm Tim Sweeney. I'm the lead policy analyst with OHP Bridge. And the question in the chat for folks who can't see it is about whether there are plans for OHP Bridge start dates to align with the marketplace in scenarios where somebody has other coverage that was terminated and not having to wait the additional month after the 15th. The short answer is maybe in the future. When we started the program and initially had the blueprint with CMS, there were only two options. One is to do the basic marketplace rules, which are the 15th of the month, cutoff date, or to use Medicaid rules and go back to the first of the month in which somebody applied. That option was not possible because of our reliance on CCOs, and so we didn't really have the ability to pick something in between. CMS has since proposed new rules that would give states more flexibility in how they choose to do their enrollment times. And I think in the future, we will consider using that additional flexibility when we can get system changes implemented to do so. The barrier, once the federal rule is changed, the barrier then becomes systems and getting our systems ready to do something different, which takes time. But that is certainly on the radar and something that would be discussed at the OHP Bridge Advisory Committee moving forward once that is launched.
Thank you, Tim. And Michael, I just found the link to the FPL chart that we had just updated at CPOP that has like the annual limits. So the link is in the chat as well.
I'm going to bring up screen share real quickly. So we've got some content here about that reply by versus renewal date issue that came up. So right now, during the pandemic unwinding, people got more time to respond. right now the renewal dates are one month before the reply by date when the member needs to act. Responding before benefits close is really the focus for all your work there, and that'll remain consistent going forward. So the dashboard currently displays the renewal date. Right now that doesn't matter much, but that's going to change with the renewals sent in October, which was in the standard timelines. We then get a chart here where you'll see those timelines for each of those various months. So right now the reply by date is after the renewal date, when that is not normally the case. It's normally beforehand. That way we can terminate at the end of the renewal date. So going forward from October, we're going to see the October wave have a renewal date of December. So they'd have to reply by the beginning of December. Otherwise, we're going to send them a closure notice by the end of December, but they still have the option to respond by the end of December to prevent closure. So here's those timelines for each of those. That's also going to be available in your collaboratives next month.
And I see we have
so
a question. Is it so or so?
Feel free to chime in with your question. Or drop it in the chat, whatever's workable.
Yes. So if you're talking, you're on mute and we can't hear you. Oh, accidental press. Okay. All right. Any other questions before we wrap up for today?
Otherwise,
Yep, I'm not seeing any, but thank you everybody for joining us today. I forgot to mention at the beginning, but we usually do a Spanish version of this webinar at the end of the month. So if you want to join our Spanish version, if you need the link, I don't think I have it handy. I might have it handy, but I'll drop it in the chat. But we do have the webinar available in Spanish.
grab that as well.